So for sleep, sauna at night and then cold room, you might have a great concoction there for a great sleep.
Either going under heat therapy, sauna, hot water for about 20 minutes or so afterwards, or even during then going to longer times of stretching certain muscles. So if you are holding certain positions after or during the stretch, that can help induce fascial plasticity.
Welcome to the Functional Code, your go-to source for decoding optimal health. Join Dr. Addy and Dr. Jace as they break down the science behind pain, performance, longevity, and more, making complex concepts easy for you to understand and apply in your life. Your journey to a healthier you begins with understanding the Functional Code.
Welcome back, everybody, to the Functional Code. We are super excited to bring to you guys today the second part of a series that we've been doing, and we first started with cold therapy, cold immersion, cold cryo, cold shower, all the things. So that's if you're interested in looking at that in our last podcast, please do. But today we're excited. We're going to be talking about sauna therapy, heat exposure, dry sauna, wet sauna, steam sauna, hot tub, you name it. We're going to be talking all about it and how it can actually improve your health, your lifespan, longevity, and there's even a lot of other protocols that we can talk about that really does help with certain parts of our health. So super excited to bring that to you guys today. As always, I am Dr. Addy.
And I'm Dr. Jace, yeah. When we're looking at heat versus cold, this is something that will also answer some of the questions that you may have. Do I do certain therapies and at what time? So we'll dive into certain specifics on that, let alone some safety considerations, and then, like Doc said, protocols as we go through. And then at the end, we're going to touch on a couple interesting cases involving heat exposure to individuals that I wouldn't suggest anyone to do, but it's fun to find out.
Quite an interesting human feat.
Literally.
Yes.
Oh. So, Doc, let's dive into the roles of sauna therapy, heat exposure. What are some of the safety considerations? Because anytime you're starting, you have to be having safety as the forefront in your mind.
Yes.
Well.
And this is for those who more than likely have never done it. If you've been doing it, I'm sure you understand your own limitations, but if you're just getting started, here are some things that we want you to understand first and foremost. Temperature awareness. You want to make sure that you start at a temperature that isn't taxing to yourself, that creates hyperthermia or dehydration. So moderate heat levels to get started. Don't drastically start at a high level, especially not only temperature but humidity as well. So you need to understand those two can play a role with that. You just want to make sure even women and children generally are advised to not use saunas. And then the last thing was planning with men. If you're trying to have kids, they do state in some studies that regular heat exposure can temporarily reduce sperm count, and with recovery taking approximately 45 to 60 days post exposure. Wow. So some mitigate this by applying a cool pack during sauna sessions, although in a hot bath that isn't really feasible. This is just something that I guess people have spoken about before and tried, but if it is something that you are looking into, I would just typically avoid it, just so there isn't any issues there. Certain methods of heat exposure, like we've talked about, can be dry sauna, wet sauna, steam sauna, hot tub, hot shower, or even just increasing the amount of layers that you wear if you're exercising can create a higher thermic effect. And again, just you might want to try each one, or just look up and research any ones that you are interested in trying before you start doing it. And then right now, I would say most people are using infrared saunas just because of its ability to be easier to use. You can even buy them and put them in your home. They're starting to become a lot more popular. So right now, traditional versus infrared, there isn't a ton of difference between the two research-wise, but I do know that infrared, a lot of people are starting to choose that just, I think, for efficiency. And there are some that are even adding bells and whistles to the infrared sauna. They sometimes add in, I think it's like a salt spray that can help. I'd have to look into that, but I know that there's one that you can do. There's different kinds of lights that you can add in the infrared sauna that might help with light therapy and just things there. So those are just a quick back end of heat and sauna therapy, and then some of the things to consider before getting started. Doc, do you want to add anything there?
Beautiful. No, that's good. Yeah, ideally being cautious and safe, and if you're going to a place asking what temperature it is, because once we get into some of the protocols, to reach certain effects, you need the temperature to be a little bit more warmer.
Yep.
So just something to consider on that side of things as we go through certain protocols and specifics here next. Besides that, and we're in some of these saunas, making sure that you're hydrated is going to be also incredibly important to pay attention to, because your body will naturally burn through calories. It'll use up water stores throughout the body. So that's where, yes, you definitely want to make sure you're hydrated during the sessions. Not only that, but even before as well.
Absolutely. I love that. And I didn't add one in here, but if you do hot yoga, I love hot yoga, and that's another way to get the hot therapy, but even adding in to the exercise component of it too. And that's actually one too where they can change the humidity in the room. So they tend to, it's different. When I lived up north, they chose to keep it at a lower humidity. But down here, I know that I've done some hot yoga and they bump that humidity up. So again, just being cautious, understanding what the temperature and the humidity is going to be set at so that you can pace yourself appropriately.
Never done myself. Interesting.
Yeah, I love it. I love it. It's great. I'll even talk a little bit about that when we come on later in the pod, just with the things that I've experienced from using it. So what we do know is there are some studies showing different protocol uses for different outcomes that you want to maybe improve in your life. So cardiovascular health, there is a certain protocol for. Just general mood enhancement, there's a different protocol. If we want to actually improve like growth hormone, muscle growth, tissue repair, there is a protocol for that. And then I think actually that was it. So I'm just going to go over the first few here and just discuss this protocol for each of those. So studies indicate that increased frequency and duration of sauna sessions correlate with decreased long-term cardiovascular risk. Protocol would be 80 to 100 degrees Celsius or 176 to 212 degrees Fahrenheit, anywhere from 5 to 20 minutes per session, up to 2 to 3 times a week. Even daily is fine, but minimum 2 to 3 times a week. Obviously, they stated the more frequent the sessions, the greater the cardiovascular benefits.
So blood flow in and out.
Exactly.
Makes sense.
Yep. And I know a lot of individuals who have started using saunas constantly use them every day now. Like they went into it with just wanting to try it, and now they have one in their home and they can't not use it. One of my good friends, I know he calls me sometimes in the morning, and he's just in my sauna, man. I could not have it today. And so I love sauna. I do it when I do cold and hot therapy after as well. I'll do sauna, and then I'll do ice or cold plunge, and then I'll do hot tub, and then we'll go back and forth. So mixing in with contrast therapy is always helpful too. But for this specific protocol, this is just what they recommended. Now the second one is for mood enhancement.
I've never heard of that before.
And I haven't either, so this was an interesting, so what they showed was regular sauna use has been associated with decreased cortisol levels, activation of heat shock proteins that assist in cellular repair, but also deliberate heat exposure can improve mood, aid in stress management, and activate hormetic pathways. So they showed a total weekly duration of 1 hour divided into 2 to 3 sessions, anywhere from 80 to 100 degrees Celsius or 176 to 212 degrees Fahrenheit. This is obviously less sessions, but about an hour total between. So if you're going to do 3 sessions, that's roughly 20 minutes per session, 3 times a week. And it's not to say that you aren't going to be getting other improvements along with the cardiovascular health and the other things that we talk about, but this one was just specific for that.
So with any sauna use, you want to make sure the temperature is at least 176 degrees Fahrenheit or 80 degrees Celsius when asking the question for temperature.
And this is, that's what research showed.
That's good to know.
And I think when they first start you out in any kind of place that does heat, like sauna, that's pretty typical. Okay. I think mine gets anywhere from 215 to 230, so I'm a little bit higher, but yeah, and you always have the ability to change the temperature on those machines too. Beautiful. If you have to start at a cooler temperature, please do. We don't want to make it too taxing on your body. And then this last one was for growth hormone release, and it talks about how if you want to improve muscle growth, tissue synthesis, bone growth, tissue repair, metabolism, this protocol can actually significantly boost growth hormone levels. So what they said was frequency would be approximately once a week or less, 30 minutes, 5-minute cool down outside of the sauna, repeat for a total of 2 30-minute sessions. And then later in the day, repeat same thing again, 2 30-minute sessions. So technically, it'll be 4 30-minute sessions in one day. You also want to do this in a semi-fasted state to enhance growth hormone release. And then for added metabolic benefits, you can alternate between hot and cold during rest periods.
Wow.
And this was something that showed higher growth hormone release versus just your typical usage of sauna use, which
right.
I didn't even realize that there was specific protocols out there for this. So
Maybe a couple times a month then.
Yeah.
It's a shock to the system.
yeah, I love it. I definitely want to even play around with it myself, just even for maybe trying to heal some of the injuries that I've sustained and what that looks like and moving forward. So I know, Doc, you talked on hydration. This is just what it ended with as far as consuming at least 16 ounces of water every 10 minutes spent in the sauna to compensate for fluid electrolyte loss. And then you can even time the sauna, where if you do sauna in the afternoon or evening, it can complement the body's cooling process. You talked about that on the last pod, I believe, where you said doing a hot shower before bed and then doing a colder temperature can actually improve your body's cooling process, bring that temperature down to improve sleep, which I love that. That's great. So again, these are just things that you can play around with before. Again, it's all about what you want to gain. So for sleep, sauna at night and then cold room, you might have a great concoction there for a great sleep.
Absolutely.
Anything you wanted to talk on with that, Doc?
Yeah, no, I think all these protocols are incredibly important. And when I look at this, like in terms of the frequency, it's like, where are you wanting to get? If you are more consistent with it, more blood flow, cardiovascular effects. If you want a shock to the system, maybe a couple times a month, then maybe for growth hormone release, it makes sense that way. So you can use it in different manners, which I thought was fascinating. And then going back to the circadian rhythm cycle, naturally your body starts increasing core temperature upwards of 60 to 90 minutes before you even wake itself, just to wake your system up. So yeah, no, I think the key point is making sure hydration is key focus, because oftentimes anytime I see anyone in the sauna, no one ever has water bottles other than me.
No.
So
You're like, okay, you're forgetting something.
literally.
No.
And then especially the electrolyte loss, whether it's adding in a pinch of Himalayan sea salt, Celtic sea salt. Going back to our hydration podcast, the fastest way we physically know how to rehydrate the system will be putting a pinch on the ton, having it absorb about 3 seconds, and drinking some water afterwards. And significantly, like even when you're feeling taxed, I started doing this like when I'm like completely worn out after a workout. Did that, it wakens me up incredibly well. Like it's incredible. So
I've been playing around with a lot more electrolyte intake, and I find that helps me. It's been helping me a lot more recovery-wise, pain-wise, focus in the mornings.
Wow.
Yeah, I love it. So even if you're not doing the sauna consistently, still realizing, especially in the climate we're in, a little more hot. It's not right now, but it can make a difference.
Oh, absolutely, Ed, from there.
So now, Doc, getting into what it actually does to the body, the biological mechanisms. Do you want to just touch on, I know that there's a few of them, but just, how is it used and how does the body react when it is used?
Perfect. So I'll dive in, and there's some studies with some of these too. So we'll touch on some of those, but I'll bring the main gist of everything so you guys have a general understanding from there. So usually when you look at heat therapy, a lot of times the first thing that comes up to people's mind is heat shock proteins, which is a key part in cellular repair. So anytime you undergo stress via heat, especially, the body reproduces these heat shock proteins, which help prevent cellular damage and then help repair certain proteins for rebuilding tissues and other aspects of the body. So there's certain studies. There's actually one that I thought was important. This study was and showed that heat shock proteins can help protect against proteins misfolding, which will help in terms of the aging process, which then also subsequently helps with neurodegenerative symptoms, diseases, and whatnot. So increasing your heat shock protein levels can help reduce age-related cellular damage and improving longevity. Then going back to what you said with the protocols on improving the cardiovascular health, blood flow to the tissues and other extremities, and then back will help.
But even for
significantly.
anti-aging properties and
Absolutely.
longevity, this has a great it's a great thing to add to your regimen if that's something you're obviously looking to push for.
Absolutely.
That's great.
So we have heat shock proteins on a cellular level helping for the longevity process. And then going back to the cellular health, there's even studies showing here enhanced blood flow, vascular health. I don't even need to go into that study. I think we already know blood flow helps open up blood vessels, help bring blood flow to wherever areas you want for healing, let alone the circulation effects it has from there, whether that's hot water immersion or localized effects. It has beneficial effects for conditions known as like peripheral artery diseases or even diabetes. Now, let's look into the metabolic activity and just even burning calories. So there's an interesting study that found sauna exposure boosts heart rate and calorie burning, showing positive effects similarly to moderate intensity exercise, which that opens up a whole ball game for a lot of things. This is fascinating. It was out of the Journal of Physiology and Anthropology, and the study was the effects of sauna exposure on cardiovascular, metabolic, and inflammatory parameters. So pretty prestigious journal on that side of things too. So when you look at just going into sauna use for the results for physical activity, it'll have other benefits, but you still want to make sure you're getting physical activity. I still wouldn't say it's in place of physical activity.
Yeah, a lot of
with
people hear
sauna
that,
use.
right? And they're thinking,
Yeah,
I think what it is showing is you do have similar heart rate change and metabolic output of
Yes.
calories, which that's going to be helpful for improving metabolism and possibly not losing weight, but maybe limiting gaining of weight, because we know that exercise and those kinds of things don't necessarily count towards weight loss. It's just stopping you from gaining anymore. A lot of research has shown that. And what we don't get from saunas would be improving muscle growth.
Yes.
And we all know just why muscle health is such a huge concern and importance to us. We've talked about that on the podcast I don't know how many times. Yeah, I like that you brought that up.
and then just to even add on to that point too, the nervous system's connection from brain to tissues is almost just as important too. So Doc said muscle growth, very important longevity-wise, but you got to connect the nervous system to the tissues,
Yeah.
unfortunately. But still, really good effects, sauna, heat exposure, compared to exercise, but just to give you guys a general understanding from
Yeah.
there. Let's look at the brain health then, especially by increasing brain derivative neurotrophic factors, or BDNF. Now, the study looked at this specific area. They found that sauna induced BDNF levels, which were associated with improved mental health, cognitive resilience, and aging in aging populations. Not only are we seeing better brain and mental cognitive effects from the sauna use, I think a lot of this will be due to not only BDNF levels, but even just blood flow to the brain as well. Automatically, we're going to start seeing positive effects from there. So
I do know that BDNF is a very focused marker on supplementation. Anything that they say increases BDNF, you usually feel this mental clarity change, less brain fog, better alertness, focus, those kinds of things. It's cool that you can also get that from a sauna, not necessarily needing to have to take a supplement or something for that. So when you have the ability to gain so many positive things just from one simple therapy, that's where you don't have to worry about doing so many other things. This could be added into your everyday routine, and you'll be getting such amazing, profound effects just from this one thing, not having to even worry about the other things of, do I have to take these supplements and do all these things? So not to say that you shouldn't, but this is already one very powerful therapy to add to your daily routine for sure.
100%. Let's look at the pain relief muscle activation then, at a localized tissue level. Now, we looked at blood vessels, improvement there, looked at brain health, a little bit of everything. Now, and in terms of cellular health, and now in terms of pain relief at the muscle tissue level. They see positive effects for arthritis, certain individuals with fibromyalgia. Now, when you look at this, what are we doing? We're increasing blood flow. We're also helping for circulation for certain joints as well. It helps with removal of metabolic waste like lymphatic drainage, and then even just soothes some of the muscles as well. So I think some of this will come back to the internal core body temperature. Anytime you raise it to a certain level, there's going to be a parameter. So anytime you're exercising for longer periods of time, it'll reach that parameter, and it's your body either has to rest, recover. It's not going to allow you to do more work. However, if you are able to raise that threshold and increase that stress resilience that we talked about previously, you're still able to do more work, but you still want to pay attention to the core body temperature. And there's different ways that you can lower that. I know we touched on it previously through the hands, forehead, bottom of the feet. So you can go back, look on that one. But in terms of pain relief, muscle relief, as long as there's no swelling in the area localized, it opens up that opportunity and ball game from there as well.
Yeah, that's awesome. And we just touched a lot on heat and cold in our last pod too, right at the end. If you want to just talk about for specific pain, we touched on that if you want to. Revert back.
And then when we look into the joint mobility, now anytime you have arthritis in the joint, you want to increase the synovial fluid, or the membrane liquid of how that joint can move, not only on the hips, but also small fingers, the toes, pretty much almost any joint that you can think of, synovial joints specifically, which helps lubricate the joint, thus better movement and less restriction, especially around the end ranges. There's also, you couple that with joint workspace that we've touched on numerous times, it'll help rebuild the tissues. So if you want to make longer lasting changes, there's a few different ways you can go about this. Either going under heat therapy, sauna, hot water for about 20 minutes or so afterwards, or even during, then going to longer times of stretching certain muscles. So if you are holding certain positions after or during the stretch, that can help induce fascial plasticity, which will help for the molding and lengthening of certain tissues. Have less friction between fascial layers as well, which can improve function and pain from that side of things. So if you couple those up, they'll have really good effects as well too.
For sure.
So yeah. And now as we go into wound healing and infection control, heat therapy can also be used in certain infectious treatments, especially like cutaneous
leishmaniasis.
I can never say that. Cutaneous leishmaniasis, a skin infection which is caused by a parasite due to being bit by a sand fly, which we don't see it too often, but it shows positive effects from there. A lot of it is due to increased blood flow, which helps promote the immune response and the body's defense mechanisms to help target that pathogen.
So it has anti-pathogenic effects. I didn't know that either. That's cool.
Finding a few small things, and I think that's just for this bite. I think it could also have other effects, but
that was just specific for that study. Yeah, sure.
I think there's other things moving forward from there that we probably should know before talking to patients more or less about that. Now, in terms of like stress reduction, I know going back to the mental health on that side of things too, will also help release endorphins, which will have a natural like painkiller type of feel, especially for tissues. Mood enhancer helps parasympathetic response for relaxation, reduces cortisol levels. And then in terms of the tissues improvement, flexibility, movements, there's a lot of aspects that can help from not only the immune response, brain health, tissue, circulation.
And then I saw one more you had put for chronic illness management.
Yes.
It helps promote circulation, which can be beneficial for chronic illnesses, but this was done on patients that had Alzheimer's as well. Now, I'm not sure. They did chronic fatigue, fibromyalgia, and even neurodegenerative diseases like Alzheimer's. And what they showed looks like just improvement of certain symptoms. Not necessarily it was curing it, obviously, but potentially reducing neuroinflammation in these diseases. It's cool that they're already looking into management of conditions with this therapy, which we all like to use it for the general health, overall wellness aspect, but this does help patients who do have certain issues, and that's great to see.
And One other fascinating part that we came up at the end between some of this heat therapy for cancer treatment. So controlled heat therapy has been applied in clinical settings to raise body tissue temperatures upwards of 113 degrees Fahrenheit to target and destroy certain cancer cells. While there's no official record that exists, this medical application pushes the boundaries. So we're starting to see research in using heat therapy for the use of cancer treatment. Again, talk to your physician provider, obviously, but it's just opening up the ballgame on what we're starting to look at as a research.
Yeah, I'm curious. I'm curious on the research that'll come out with more of that. I think that's great. I know that we've heard certain stories from patients in the past that use certain, whether it's hyperbaric chamber, whether it's hot, cold, all these things, and notice a considerable difference regarding the symptoms and health changes that obviously one gets going through either treatment or just having cancer itself. I do know there's one thing that's going around where if you actually apply like a cold pack to your scalp the entire time during your chemotherapy. And apparently it can actually stop or at least reduce the effects of hair loss with chemo. I've been seeing that more on social media. So again, not so much heat therapy, but cold. But again, all this stuff, super interesting how it affects the body and all the things of the outcomes that we can get. More to come, obviously, with research. But yeah, super, super interesting.
That's fascinating. It makes sense too. You constrict some of where the follicles come out from there, which helps.
Yeah, I'm not sure the mechanism. I'd have to look into that. But I do know that it's being done, and more people are doing it. I guess is because it has been working. So I'm not sure if there is research regarding that or not. Yeah, if you've done it, or if you know anybody that's done it, just let us know in the comments what that's and how that's been, because I'm super interested in learning more about that. Absolutely. And just recommending that to my patients. So Doc, I know you last podcast talked about the gentleman that could swim under ice for around 600 feet, 2 football fields. Yeah. And he did that, I'm sure the temperatures of that, he did it under ice, so that had to have been in around the 30s, maybe 30s to 40s. You and I don't know how long you can last, but I can do about 3 to 5 minutes under ice. I don't know how long he was under ice, but that was incredible.
I can't even imagine.
So now we're going to also talk about documented feats, but this is with heat now. And I know you have a couple of them, but I'm just curious what you have for everybody regarding some interesting extreme heats that people have occurred, at least been documented.
Yeah, when I was looking over this, I wouldn't suggest anyone to do this, but yeah, so the first one, this was like the unofficial title given to this guy, was the man who walked closest to hell. So he got so close, and this gentleman was a photographer, George Kuronis. I may have mispronounced his name. He's a volcanic photographer. So he goes and looks at volcanic action, takes pictures of stuff like that by the looks of it. So he went to Mount Kilimanjaro, which is in the Republic of Congo, which is one of the largest dangerous lava lakes on Earth. The temperature of that lake reached 1,200 degrees Fahrenheit, or to put into perspective, 650 degrees Celsius at the surface, and then it is more intense, obviously, through the magma itself. So as he went up, he went within feet of this lava lake just to take photos, some rare photos to say the least. During his descent, during the volcanic activity, he had to undergo toxic fumes. Oof. So he was wearing a custom-built heat-resilient suit, carried a bunch of cooling packs. He also had contents which help for the gases, but there was risks of falling rock, and the proximity to this magma was, I'm sure, incredible. At the end of the day, he was the one that came closest to the lava lake at, 1,200 degrees Fahrenheit. I can't imagine how long he was there.
That's not even an oven, man. That's like, I don't even know what things get that hot.
Doubled it twice. So
yeah, like welding fires.
Literally.
It says that his soles began to melt.
Could you imagine?
Oh my God.
So yeah, that's incredible.
That's cool that he did that. I don't want that record,
not.
so that's impressive. I still
Yes.
some days feel like Arizona gets that hot, but
That's another
it's
ball
funny.
game.
That's nowhere near 1200 though.
And then the other interesting one, this was the longest sauna marathon recorded. Now, this was between two individuals, record, which I thought that was fascinating. If I pronounce the names wrong, my apologies. Timo Kakkonen and then Andrea Broxman. So a gentleman from Finland and Slovakia. And they did this in Finland. This was in 2009. There was extreme sauna exposure, and the intensity was actually much warmer as well. It was 230 degrees Fahrenheit.
So they're a little higher range, yep.
Which is, yeah, compared to most. And they did that for 16 hours and 15 minutes.
Straight. I don't know how they didn't die. I just obviously they were consuming water during it, but
Yes.
man, what a change to their heart. I'm curious what their heart levels and their markers look like if they did a before and after blood test.
Brain.
Oh, totally.
'Cause I can only imagine how toasted their brain.
And then what did they feel like days after? Just so many questions.
Oh, so yeah, so they went under a bunch of, so they had to take into consideration the rapid sweating, the dehydration, the increased heart rate, also the mental and physical challenge of just staying there for 16 hours is incredible. I can't imagine the therapeutic effects it had afterwards, but it definitely holds the record for undergoing a sauna. So definitely no one, by all means,
Yeah, if
unless
you're just
you're
jumping,
trained for it.
just jumping into this, don't look for that record. But
Definitely not.
That's super cool that humans are pushing themselves to those states. Yeah. With that, Doc, anything else?
Beautiful. Yeah, no. Subscribe, share. As always, if you have questions with anything that we didn't touch on in terms of heat therapy, I know there's like different types of like wax therapies, paraffin bath, like certain specifics that we didn't get into from that perspective. But when you look at the whole of, we wanted you to have a general understanding of not only some of the research, some interesting stuff behind heat therapy, but different protocols to use as well. So I thought we tackled that quite well.
And we compiled a pretty big list from a lot of experts. So if there's some people that you like to listen to that you feel, Huberman's in here.
Yeah.
There's a lot of other individuals in here too. So yes, please let us know in the comments what you think. And until next time, guys,
Absolutely.
you guys have a great day.
Woo! Beautiful.
Disclaimer, the content provided in this health podcast is for informational purposes only and is not intended as a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast. If you think you may have a medical emergency, call your doctor or 911 immediately. Reliance on any information provided in this podcast is solely at your own risk. The creators and hosts of this podcast are not responsible for any actions or decisions you may take based on the information presented.
Thanks for joining us on The Functional Code. For more evidence-based health insights, subscribe, rate and review wherever you get your podcasts. Remember, your journey to a healthier you begins with understanding the Functional Code. Until next time, stay well, stay informed, and embrace the science of living well.